Good morning. We've got a distinguished panel for you today here. We're going to discuss the changes that are being made in the health insurance program for Medicare-eligible retirees for both state employees and teachers. The impetus of this is that it was a requirement that's in the new master contract, collective bargaining agreement between the state of Illinois and the American Federation of State, County, and Municipal Employees. On our panel this morning, we've got Dave Amerson, who is the retiree coordinator for AFSCME. We've got Janice Bonneville, who is the Deputy Director for the Bureau of Benefits for the Department of Central Management Services. Bruce Strom, who is the President of the Retired State Employees Association. And Will Lovett, who handles insurance and pension issues for the Illinois Education Association. My intention this morning is for us to focus less on how we got here and more on what this new program is going to require and provide, so that all of you can leave here with more information about what your options are going forward. But initially, for a couple minutes, I want Dave to maybe explain to us how this ended up in the collective bargaining agreement and what AFSCME sees us getting out of this, what the contract requires, and what the benefit. So, go ahead.
Thank you. I wanted to just take a few minutes because I know most people are here to hear what Janice has to say, you know, the plan designs and all that, but I did want to place all of this in its proper historical context, just because we get a lot of questions about why AFSCME did this or why AFSCME agreed to this. So I want to take a few minutes and clear the air on that point. Our retirees, throughout their working career, were promised a certain level of retirement security when they retired. One of those issues was that they would not have to contribute towards the premium of their health care in retirement. This doesn't mean that our retirees had free health care. They still, of course, paid co-pays and deductibles, but they didn't have to contribute towards the premium of their health care. Now, a lot of people, when they have a promise like that and they know that that's going to be waiting for them during retirement, plan their retirement security around those points. So we have people that maybe didn't go to a different employer because they had this promise waiting for them at the end of retirement. Maybe they entered early retirement because they had this promise waiting for them. Well, the General Assembly, let's fast forward to 2012. The General Assembly passed and the governor signed Senate Bill 1313. And this basically upended that entire health insurance scheme that has been in place for over 30 years. So what Senate Bill 1313 did was give the administration unilateral power to set those premiums to whatever level they want. And when they came to the table and told us what they wanted to set them at, they were talking 20 to 25% of our retirees' annuities. Okay, so for someone on Medicare, this could have been as much as $8,000 more a year out of pocket. That's the legislative framework, and that's the bargaining framework that led us to Medicare Advantage. Now, AFSCME was bargaining for this contract for over 15 months. And when we finally settled, you know, our main goal for retirees was preserving retirement security and preserving their health care benefits. But the state, of course, needed to save money. That was their main goal. So we had to find common ground or a compromise, and that compromise was Medicare Advantage. Okay, so we also, though, didn't want Medicare Advantage to just be a pretense to later raise rates or reduce benefits in some way. So we secured collective bargaining agreement language that says that essentially the cost, quality, and access of these plans has to be comparable to what retirees had before. So we felt that that language would adequately protect our retirees during this process. And by agreeing to Medicare Advantage, instead of a 25% or 20% premium hike on our members or our retirees, our retirees are now only paying 1% if they're Medicare eligible and 2% towards their premium. So that's what Medicare Advantage, that was the compromise and why we landed on Medicare Advantage. We still maintain to this day that Senate Bill 1313, which started all of this rolling, we still maintain that that bill and that law is unconstitutional under the Illinois Constitution. And actually, us, along with 3 other unions, sued on that point, challenging the constitutionality of that law. And the Illinois Supreme Court heard that case last month. We're still awaiting word on the decision of it, but we maintain throughout all of this that Senate Bill 1313 was an unconstitutional diminishment of our members' retirement benefits. But now here we are in Medicare Advantage. Here we are, and Medicare Advantage is beginning its rollout. We have reason to believe that our members, our retirees, are going to be taken care of during this process. The reason that we have reason to believe this is because of that union contract language. And you know, I guess at AFSCME we're kind of old-fashioned. We still think that union contracts mean something. So beyond that, Medicare Advantage, you know, there's a lot of talk out there, there's a lot of pros and cons about it, but the fact that out of just the general populace, people that just have Medicare, that don't have a state health insurance, supplemental or anything like that, 25% of people have voluntarily enrolled in Medicare Advantage plans across the country. So these aren't something that aren't well established. They've been around for quite a while. We are conducting our preliminary review on the comparability of the plans that have been released by CMS and making sure that they comply with the union contract. And we are pleased to note that in some instances that these plans actually offer enhanced benefits for our members. So I would say that right now the AFSCME is hopeful. That's, I guess, our general mood about what's going on with Medicare Advantage, with the caveat that we're going to be constantly monitoring the implementation and rollout of these plans to make sure that they comply with the union contract.
Thank you, David. That was very helpful, and I suspect this entire room would probably tell you that if given a choice between having to pay high premiums or have a restriction on benefits and having to go down this road that we're discussing today, we'd probably, after this session is over, conclude that we would rather do the latter. With us today to explain what this program is and why CMS embarked on it, and maybe answer a common question that retirees have about why is the state making me give up my Medicare coverage, is a really outstanding individual who's got a tremendous background in this area and has been made the point person for the administration on this, Janice Bonneville.
Okay. And I'm going to apologize first to my panel, and if there's any of you in the audience that know me and have seen me speak, you're going to know what I'm going to say next. And I apologize, Rick, I know you're moderating, but I'm going to go over there because I'm a walker. So if I'm going to talk to you, I have to walk and talk to you, okay? I apologize. I'm not a sitter. Okay, so I'm Janice Bonneville, Deputy Director of Benefits for CMS, as Rick indicated. The Medicare Advantage plans came out of both the union contract and then legislation that was passed last spring that mandated that we release a procurement to do a Medicare Advantage product. So that's what CMS did in concert with the CPO's office. We released a Medicare Advantage, a Medicare procurement, asking for bids for Medicare Advantage PPO, Preferred Provider Organization, HMO, a Health Maintenance Organization, and a Medicare supplement. So what's a Medicare Advantage plan? A Medicare Advantage plan is simply a plan that combines your Medicare Part A benefits, your Medicare Part B benefits, and your Medicare Part D benefits. So right now, all of you, assuming everyone in the room is Medicare A and B, and I've asked this question, this is the third group I've spoken to this week, I've asked this question every time, if you're here and you are not Medicare Part A and B, or you have a dependent who is not Medicare Part A and B, this change does not apply to you. If you carry a dependent who's not Medicare Part A and B, it doesn't apply to you. That means if you have your grandchild or a child on your plan, or you have a younger spouse on the plan who's not Medicare yet, it doesn't apply. One thing to Rick's comment earlier, it is state, teachers, and college. All three of those plans are impacted, and each impact is a little different. So Medicare Part A, Medicare Part B, Medicare Part D. D is your pharmacy. So those three pieces are combined together into one product, a Medicare Part C. So if there are any teachers in the room, if you can explain to me how I can take A plus B plus D and equal C, I would like to know, okay? So that's what a Medicare Part C is, Medicare Advantage, okay?
Can you maybe explain the difference? My understanding this is being done under a group waiver from Medicare, and that the benefits are substantially better than what are offered under the individual Medicare Advantage plans that are being marketed by individual insurance companies. Can you?
That's correct. Okay, so we have four contracts. The first one is United Healthcare Preferred Provider Organization. Ordinarily, when you go to a PPO plan, you have an in-network benefit and an out-of-network benefit. So your in-network benefit is usually a better benefit because they want you to go to the doctors that they have contracts with. When we released the request for proposal, we released and requested a passive network, which means that regardless of whether your doctor is in the network or out of the network, your percentage of responsibility is the same. Under the plan that we have designed, the state pays 90% of the cost and you pay 10. No matter if your doctor's in or out of network, you pay 10%, we pay 90%. The maximum out-of-pocket cost for that plan under the state plan is $1,300. Under the teacher's plan or the college plan is $1,000. For the teachers in the college, instead of 90-10, you're 80-20. And if you go back and look at your benefit materials that you may or may not have, under the Cigna contract for the state, your in-network benefit is 90-10. And for TRIP and SIP, your in-network benefit is 80-20. Your out-of-network benefits are significantly higher than that. But those are your in-network benefits now, and those will be your in- and out-of-network benefits for the PPO plan for the Medicare Advantage.
So what you're saying is if somebody enrolls in the United Healthcare PPO, that they'll be able to go to any doctor or provider that accepts Medicare Advantage any place in the country, and that and if they're a state retiree, after they've paid $1,300 out of pocket, the state will pay 100%, and for teachers it'll be that 100% will kick in after $1,000 per person.
That's correct. The term we use is any willing provider. Okay, and everyone knows that you can't make a provider see a patient. I can't do that. Okay, but the rules for Medicare Advantage are that if the doctor is allowed to take Medicare, so if they're on the Medicare list, then they can accept a Medicare Advantage product. We have some large facilities in the central Illinois area that this has become an issue. And we have commitments from a number of those facilities already that they'll see these patients as out-of-network patients. United Healthcare is reaching out to facilities. If you have a doctor that says, I don't take this, then that's the time that you're getting on the phone with my staff, or we're getting on the phone with the carriers to say, can you reach out to this facility or can you reach out to this doctor so we can resolve this issue before February 1st, which is when these plans become effective.
Are the deductibles going to remain the same, both for the major medical and prescription drug?
The deductibles actually go lower. So right now under the state plan, the deductible I believe is $350. Under the PPO plan, it's $100. For teachers in college, I believe those deductibles are $400 and $500. Although I can't stand here today and tell you no, $750. Those deductibles will be $250. For pharmacy, the deductible for the PPO is $100 and the deductible for the HMOs is $75, just like it is. And let me touch briefly on pharmacy, because I know there's a lot of discussion, and I know that the original reaction from a lot of people is, I don't want to do this, I'm just going to stay in Medicare and I'm going to buy my own plan. And everyone has the right to do that. if that's the decision that you make. The request I've made to every group I've spoken to, and this is the third group this week, not counting 2 legislative hearings, is at least take the moment to look at what we're sending you. Okay, take a moment to look at the enrollment kits you're going to get in the later part of October, the first part of November, before the enrollment period begins, and really look at those compared to what you're looking at online. Pharmacy is a big deal. If you're familiar at all with Medicare Part D plans, they have this wonderful concept called a donut hole. The donut hole says when you reach approximately $2,500 in pharmacy, the plan essentially stops covering your pharmacy until you get to the catastrophic level, which is $4,500. Okay, so there's a gap or a donut hole. There is no donut hole in the state plan. We've covered the donut hole so that you will pay your normal pharmacy copayment from 0 up to $45.50. At $45.50, the copay rules change. That is not within our control or within the control of the carriers. If it's a generic drug or a brand drug, the copays go down, or it's a percentage of the cost of the drug. Okay, that's a Medicare Part D rule. That is not our rule or the carrier's rule. But there's a significant difference in cost if you're talking about you spend, $3,000 a year in pharmacy. If that's a level that you are currently at under your current plan, that donut hole is going to be an issue for you. So we're covering that donut hole to make sure that you don't have those issues. We're covering if you go to a doctor and they say, well, I understand that's all Medicare pays, but I'm going to charge this. The doctors cannot balance bill you for the services. We'll cover that charge. All of that charge comes back into the state, back to the carriers to be covered.
Well, we're talking about the pharmacy. Are you going to continue to use Express Scripts? Are the networks going to be the same? Are there going to be restrictions on the pharmacies we can use?
The networks are different because it's a different carrier, but the pharmacies change all the time. If you are, just recently, Express Scripts brought up Medco. Prior to that contract, we had pharmacy benefits through Caremark. If you change from one HMO to another HMO, you may have a change in your pharmacy benefit manager. I do know for a fact that Coventry Advantra, which is one of the 2 HMO products, uses Express Scripts. I know that Humana uses RightSource. Actually, I know all 3 of them. And United has their own internal pharmacy network. Okay, so they're all a little bit different. However, just like the plan design, we've talked to the carriers and said, at least for this initial rollout, because they have to have their pharmacy list certified with the federal government. We need to see that pharmacy list so we can make sure that we are seeing comparable drugs on your list to what we're seeing on what members are used to right now. Can that guarantee that every single drug will be on the list? Absolutely not. Because I could have a phone call when I get back to my office today from Express Scripts saying, beginning next month, this drug's no longer going to be on the formulary. Formulary changes happen all the time. But we've taken every step that we can take, at least we believe we have, to protect the members moving forward in this process so that they see, so that the transition is to the greatest extent possible in terms of who you can see, how you get your medical care, where you get your pharmaceuticals, seamless.
So, will we still be able to use retail pharmacies? Will that be up to the carriers?
You will still be able to use retail pharmacies just like you currently do. That's part of the bargaining contract. That has not changed, but you'll have the mail order option as well for those of you who use the mail order.
Can you briefly explain what the premiums, and obviously you can't go through the entire chart, but I understand that the premiums, particularly for dependents, are going down over what we're currently paying?
Well, it depends on how you look at it. Okay, so I'll do the state plan first. So state plan retirees pay, if they're Medicare, they pay 1% of their annuity. And I will just make one clarification. The percentages that were originally put at the bargaining table were not percentages of annuity, they were percentages of cost. Okay? That may not make any bit of difference to you, but it makes me feel a little better that I've clarified that it wasn't percentage of your annuity, it was percentage of the cost of the health care. So, retirees pay 1% of their annuity. Retirees with less than 20 years of service pay a percentage of cost based upon how many years they have. So if you don't know what I'm talking about, then you can shut me out for a couple minutes here. But if you currently pay a portion of your annuity because you have less than 20 years of service, you're going to see a reduction in your cost. Currently for the HMO plans, the 100% rate is somewhere right around $380. The 100% rate for the most expensive HMO plan or the Medicare Advantage is $212. So your 5 or 10 or 15% of that amount is going to be lower. For the United Healthcare PPO, it's right about $180. So for folks with less than 20 years, that's going to be a reduction. For dependents, if you're in an HMO plan now and you move to an HMO plan, your rate's going to stay about the same. If you're in quality care right now and you move to the PPO, your rate's going to go down. Your dependent rate right now under quality care is $142 for a single dependent. It'll be $110 under the Medicare Advantage plan. If you're in an HMO, however, because those rates are set individually, and you move to the PPO, you're going to see a bit of an increase in cost for that dependent. Okay, our HMO rates average around $89. The rate for one dependent's $110, so that's going to go up a little bit. For the teacher's plan and the college plan, your rates are going significantly down. Significantly in the, I think the least reduction in rates is about 45%. So if you're in the teacher's plan or the college plan, both the member rates and the dependent rates are going down. And although I know you haven't all gotten them yet, letters are coming out to all of you, everyone who's impacted. So again, Medicare A and B primary, all dependents Medicare A and B. Medicare A and B primary because you turned 65 before the 30th of September. If your birthday was in October, this doesn't apply to you until next year. Okay, so letters are coming out to you. We printed them on canary yellow paper. Please don't throw them away. For the teacher plan and the college plan, your rates are right in that letter. For the state plan, the dependent rates are in there, but because again, we're on the percentage of annuity and the 20-year list is rather lengthy, those aren't in there.
Can you discuss how claims are paid? Right now, Medicare pays its 80% share promptly, and then the state's taking 10 months or more to pay its 20% share. Now the state's going to be responsible for 100%, but I understand this is a fully insured plan, and so how timely will these claims be paid?
Okay. The last statement that Rick made is the most important. This is a fully insured plan. What that means, okay, so on the state side, the claims hold on the Cigna plans, on the dental plan, those are a result of a lack of funding availability in the state. We pay the vendors an administrative fee, but then we fund their accounts to pay those claims. If I don't have the funds to pass the vendor to pay the claims don't get paid. In a fully insured product, it simply means that we pay the vendor a set premium amount based upon what the vendor thinks the plan is going to cost. And then the vendor takes that amount and pays those claims. If the cost is lower than what we pay them, then the vendor makes money. If it's higher than what we pay them, then the vendor loses money. They take all the risk. At the COGFA hearing on Wednesday, we spoke directly about this in terms of what happens if I have that provider that says, you know, worst case scenario, I want you to pay this up front. The United Healthcare PPO carrier, they joined me at the table and indicated that for that kind of a claim, even if the member is paying up front and they're turning the claim into United, the turnaround is approximately 10 days. Okay? So it's a fully insured product. United Healthcare and Coventry and Humana are large carriers. United Healthcare is the largest carrier of a Medicare Advantage plan in the United States. They have extensive networks, so their ability to keep this process moving forward. They're also monitored by federal CMS to be able to offer a Medicare Advantage plan. So there are a lot of things that they have to be able to do to ensure that they can keep the plans that they're offering and keep their rating with Medicare.
What do retirees have to do now to sign up for this new coverage? Can you outline the enrollment,
Sure.
The open enrollment period and the effective date of the new coverage?
Sure. So the biggest difference for this year is ordinarily when you get your benefit choice materials from us, we put in there somewhere, or they put it somewhere in your letters from the retirement system, if you like where you are, you don't have to do anything, right? You don't have to change, you don't have to fill out a form. For this enrollment period, which is November the 12th, which is a Tuesday, because I didn't think you would appreciate November the 11th, which is a Monday, which is a holiday when the offices would be closed, until December the 13th, which is a Friday, I know. Okay, so we go from Tuesday, November the 12th, to Friday, December the 13th. You're going to get, if you haven't already gotten, the letter from us this week, which gives you general information. Then you're going to get a postcard from us that says open enrollment is coming. That postcard goes out the 30th of this month. Then you're going to get a large enrollment kit from my office. Well, not from my office. It's going to come from an office in New Jersey. It is totally, it's ours. It's okay. You can open it. It's ours. It's going to have an enrollment kit, which is approximately 16 pages long. It's going to have an enrollment form, and it's going to have a schedule of seminars. Okay, that is going to give you even more information than you're getting today. Okay, formal seminars are being scheduled all over the state for this plan. When you get that kit, you need to take a look at it. It's going to give you information in general about the plans. You're also going to get information from the plans that are available in your county. So the availability of a Medicare Advantage plan is driven by the county in which you reside. So if you reside in Sangamon County, you have access to the plans that are available in Sangamon. If you reside in Peoria, Tazewell, Logan, it's driven by where you reside, okay, your permanent residential address. You're going to get those documents as well. Every document that you receive from us or from the plans with whom we have a contract, with the exception of the canary yellow letter you're getting this week, every one of those is going to have a logo on it that says Total Retiree Advantage Illinois. Okay, every one of them is going to have that. So if you get a mailing from somebody else in your house that doesn't have that, and they purport to be one of the state-sponsored Medicare Advantage plans, they are not. Every one of the things we send out says Total Retiree Advantage Illinois on it and has a logo. You're going to see that logo and that statement for the first time on that postcard you get. Okay, that's what you're looking for. Okay, we want to be sure people don't inadvertently sign up for a plan that's not one of ours. Okay, so you're going to get that information from us. You're going to get the information from the vendors. From November the 12th until December the 13th, myself and my staff are going to be throughout the state. We're scheduling 2 seminar locations a day. In most cases, 2 seminars at each location, one in the morning and one in the afternoon. We are not scheduling seminars in the evening. We don't think that's particularly convenient for the audience we're trying to meet. If we find that we don't have enough, then we'll try to schedule some more. Okay, right now we're not scheduling weekends. I would prefer not to do that, but if we have to go to weekends, then we'll go to weekends. During those seminars, we're going to talk about, you're going to have to listen to me again, we're going to talk about exactly what is in your packet. We're going to step through section by section that enrollment form so people understand exactly what has to be done. The biggest difference on the enrollment form is that everyone in your household has to sign it, or someone has to sign it on their behalf. So right now when you make a change, you sign the form and your dependents are with you. Under Medicare Advantage, everybody has to sign. It's a federal government requirement. Okay? The form is lengthy, 8 pages. Okay? But it's a lot of the same information. So for the member, Medicare number, Medicare dates, your choice of health care. For the dependent, Medicare number, Medicare dates, your choice of health care. Everybody has to be in the same plan. Everybody has to pick the same plan. So you have to decide which plan works for your family. Okay, and everybody has to sign. For the state plan, it also includes your dental and your life insurance. Those options on there as well as for college. Teachers, you don't have dental and life insurance available, so that's not on your plan. It also includes I want to opt out. Okay? If you sincerely want to opt out of one of the state plans, either state, teacher, or college, please mark the box and send the form back into us so that we know that you have actually made that decision rather than have it just happen as a termination in our system. Because if we don't get a form back on February the 1st, your coverage will be terminated under the state of Illinois. You will retain your Medicare coverage, traditional Medicare, but you will no longer have coverage through the state of Illinois. For teachers in college, and I'm sorry, I know I'm going to get long. We're going to go over an hour, I know. For teachers in college, and I talked about this on Wednesday as well, under the state plan, you currently have the right to opt out. If you opt out of the state plan and you go to a different plan and you decide later on, you know what, I want to go back to the state, you have the right to come back. Under teachers in college, if you cancel your coverage, as the law currently is written, you cannot get back into the state plan. Okay? I spoke about this Wednesday in front of the Commission on Government Forecasting and Accountability, and I told them that this office would absolutely support a change to legislation to allow that to occur. But right now, we cannot do that. When the teacher's plan and the college plan were designed, those eligibility requirements were placed in them by the teacher's retirement system and the state university's retirement system, respectively. CMS has not always run these plans. So for those plans, if you're a teacher or a community college enrollee, please, again, I want everybody to pay attention, but please, please, please pay particular attention to the choice you're making so that you don't somehow inadvertently exclude yourself from ever being covered under the state plan again.
One I guess, technical follow-up question on the enrollment kits. Are they going to be mailed first class or bulk rate?
They're going to be
I'm
mailed.
concerned about the ability to forward them.
They're going to be mailed first class. I know we have a number of people who travel in the winter because they don't like 26 degrees on October the 25th. And hopefully, we have that second address in our system. We have a lot of second addresses for retirees, a lot of mail-to addresses. So those will send. If they don't, they come back to us, and then we send them to the retirement systems to get them back out. One other important fact on the forms is that we have a number of individuals, particularly those that travel, that use a P.O. box for their mailing address. Federal Medicare requires a physical residential address. We won't change your address in our system, not for mailing, but we have to have a physical address under federal Medicare requirements. So please keep that in mind as well. And all of that information's on the form, and again, we're going to step through it at these seminars. Besides myself and my staff at these seminars, the vendors will be there to answer questions as well, depending on the area in which the seminar is being held. The vendors who are available in that area will be there as well.
Thank you, Janice. This has been helpful. Bruce Strom, I'd like you to go next, and he's the president of the Retired State Employees Association, and maybe you can tell us what kind of reaction you've been getting from your members.
Well, it's interesting. By the way, Janice always does a nice job of presenting information. Yes. We have had her as a guest speaker at the Retired State Employees Association member meetings over the years, and we've also had an opportunity to speak with her representatives from several retired state employee organizations, universities, and state employees have met with her from time to time. I kind of smile when I think about the last couple of times we've met with her. I think it was in the summer. We met with her, and she opened the meeting by saying, I can't tell you anything, and at this meeting. And then at the last meeting, which was a few weeks ago, or maybe it was, anyway, she opened up the meeting a couple weeks ago with a similar statement. I don't know if it's I won't tell you anything or I can't tell you anything, but it was something to that effect. And so, and of course that reflects part of the concern that the retirees have had, and that is the limited information that's available. One of the things that we've tried to do as an organization, and I know the others have also, is share as much information with our members as we can, as it's available. And this has been a very difficult thing to do, given all the rules and regulations related to the procurement process, I think is the reason why there's so little information made available. I probably floated away from your question. I don't know if I've answered your question.
That's, I think you're getting at now that we have more details from Janice on what these plans involve, do you think that all of us as retirees will react more favorably to them, or maybe just be less anxious?
That's hard to predict. I think that Janice, and when she expresses explanations of things, makes it sound so simple. But I think for the average retiree, or maybe most retirees, the process is viewed as very complicated and having a major effect on their lives and the lives of their dependents. I actually, in preparation for this panel, and I'm not a regular speaker, public speaker, but I made some notes to myself and basically didn't anticipate going through a question and answer cycle quite at this time. I thought there'd be some opening remarks, and I'd kind of like to share those with everybody because I think there have been and there is going to continue to be concerns of people, of retirees, regarding what is happening to them, and that many of them, most of us, didn't really have a role to play in where we are with how we got here and what the decisions were made. And so, if I could, I'd like to kind of go through my comments, and hopefully they won't be distracting to you. But I think I'd like to be on record as sharing with you what I, as an officer in a retired State Employees Association group, has been hearing from our membership, and I'm sure that the other retirement groups have had these same concerns, and the officers have been hearing probably the very same questions. Would that be all right?
Yeah, absolutely.
Okay, for those of you who are not state employees, you are probably not familiar with the issues regarding the new state retirement program that's being implemented by CMS. Now, I made that comment based on the assumption there'd be lots of people here from the general public, but I'm not sure that's the case. As I saw people arriving today, I think most of us are probably retirees or related to a retiree. So for those of you who are state retirees and are related to a retiree, you're probably not familiar with or knowledgeable about the health care coverage design and how you or your relative will be affected. Now, Janice has started to address some of those issues and, as a result of Rick's questions. But I think it'd be fair to say that everybody is here today to learn more about what is happening with the retirement benefit for retirees, state retirees of all sorts. So, retirees have been experiencing a considerable amount of anxiety because of the significant change they will be required to make, because of the limited amount of information that has been made public about the insurance programs being offered, because of the absence of a Medicare supplement plan as one of the choices, because of the limited time available to evaluate the options and make a choice for them and their dependents, and because of the failure to allow the Health Alliance bid to be considered. Now, I know that David and Janice have both provided some information that sort of address, some of these questions. But I think it's helpful to get a picture of the difficulty that state retirees have been faced with and are continuing to be faced with. And to that end, I'd like to present a list of questions and concerns that have been presented to me, and I'm sure to other retiree organization officers. But before I do that, I think it's noteworthy to mention, and Janice already referred to this, that on this past Wednesday, the Commission on Government Forecasting and Accountability held a hearing to review the healthcare procurement process. This commission is made up of 12 legislators. Half of them had the same questions and concerns that I am about to share with you and expressed concern regarding the procurement process used to award the insurance contracts for state retirees. I also thought I was going to have a body mic on today, so we've got not enough hands here. Retiree concerns, sort of in the overall global view of things, retirees are experiencing confusion and difficulty in making a choice because primarily of limited information that's occurred and the time limit, the limited amount of time that's available to evaluate options. Retirees are also concerned about the failure to award a contract for a Medicare supplement policy. Retirees are concerned about the possibility of having to change medical providers. Retirees are concerned about the failure to allow the Health Alliance bid to be considered. And because of the concerns about Medicare Advantage plans and the interest of many retirees in having a Medicare supplement policy as a choice, retiree groups early on expressed their interest in having a Medicare supplement as one of the choices coming out of the contract bid process. Now, the original CMS plans did not include going out for bid on a Medicare supplement plan. However, as a result of the widespread interest, they did go out and ask for a bid on a Medicare supplement plan. Retiree comments and questions and concerns regarding a Medicare supplement policy include: one is there is a strong and widespread preference to have a secondary insurance policy, a Medicare supplement, like that currently available with the Cigna Quality Care. This would allow retirees to remain in the original Medicare program. Two, retirees would like a meaningful reason as to why a Medicare supplement policy was not awarded. Three, retirees are concerned about being forced to leave original Medicare in order to have access to the state's health care program. Four, there are questions about why AFSCME supported or possibly recommended that the state adopt a required Medicare Advantage program for retirees, but not a Medicare supplement policy also. Retirees ask, what is the advantage for retirees to have Medicare Advantage choices but no Medicare supplement choice? And six, given the reports that the federal government has been trying to do away with or reduce its support of Medicare Advantage programs around the country, why has the state and AFSCME chosen to implement a health care program limited to only Medicare Advantage insurance policies? Now, going forward, other retiree questions that we receive, and basically what I'm trying to do is reflect to you what we as officers in an organization have been hearing from people like you. How will the insurance deductibles be handled when a retiree moves to one of the state's new Medicare Advantage health insurance policies in 2014? Now, I realize that Janice has been addressing some of these as questions from Rick. Two, regarding comparable benefits, what are some examples that compare services received under the current insurance policies versus the Medicare Advantage choices? How is the estimated $100 million per year saving derived? For example, what is the amount of revenue that the state will receive from the federal government? What is the total cost of the insurance premium to the state? How is a Medicare Advantage program more cost effective than regular Medicare with a supplemental policy? What will the amount of out-of-pocket expenses be for retirees? Legislation which authorized CMS to establish the new retiree health care program removed the 30-day review by COGFA, the Commission on Government Forecasting and Accountability, the review cycle that they normally perform for this health care procurement process in order to expedite the process. Well, what happened? The insurance contract award process has been delayed, and the sharing of information about the policy designs has taken a long time. 8, will retirees be able to continue receiving services from their current Medicare medical providers? And then there is a question out there, and Dave sort of alluded or mentioned this earlier, and that was, what happens if the Illinois Supreme Court rules in favor of retirees in the Mag versus Quinn lawsuit, and then the state is no longer in the same position in terms of having the authority to do what they're doing? So I wanted to share this. I know it was kind of a long set script of information, but I wanted to share it because probably the most important thing that we as officers in retirement groups are the concerns and the confusion that you all have been expressing to us about this policy and how to make the decisions that will be appropriate and beneficial to you. We are all hopeful that it will turn out to be good for us in the long term. But we are very concerned, I think, in the short term that the information we're being provided and the timelines we're being asked to make decisions that are very important in how our lives and our quality of life goes is very short. And we're basically not being given all the choices that probably would have been helpful for us to make. Thank you.
Thank you, Bruce. Janice, two questions that Bruce brought up that maybe you can address is, and I think you addressed one of them Wednesday, about the deductible reset, as to whether the charges that have been, that each of us have had that have gone against the deductible between July 1 and February 1, will those carry over and be applied to the new deductible, or will it, as you say, reset and we have to start anew for the next 11 months? And then maybe you can, without, I know it's a complicated issue, but, and most of it was addressed at the COSCA hearing on Wednesday, but can you briefly tell us why CMS didn't award you got 2 bids for Medicare supplement plans and rejected both of them. Maybe you can just say for a shorthand version of why you did that.
Okay, to the first question regarding the deductibles, I talked about this on Wednesday. We're currently working through the logistics to ensure that if a member has met their deductible already, they won't be required to meet their deductible again. We're working through that because there is no mechanism under federal Medicare for us to waive those deductibles in a Medicare Advantage plan. So that has to occur with the staff in my office to make that happen. So we're working on that issue right now. With respect to the second question, the procurement was released and processed and completed within the terms and boundaries of the Illinois Procurement Code, both for purposes of the Medicare supplement and for purposes of which vendors were selected or which vendors were reviewed as possible selections. As Dave indicated, this was a significant issue under the negotiations on the master contract, and both those negotiations and the subsequent budget for the group insurance program for fiscal year 14 included assumptions based upon the savings that would come by moving to a Medicare product different from what the state currently offers. And simply put, the Medicare supplement plans that were presented, only one of which was considered, the other one was not considered, simply did not meet those goals by any stretch of the imagination. It's our belief that the Medicare Advantage PPO and the HMOs, depending on where you live, give members access to the doctors and the hospitals that they've been accessing and that they have been used to, and gives them that access in a financially comparable way to the way they've been receiving that access today.
And then one final question we'll put you on the hot seat for is the revenue stream. Can you kind of discuss what these carriers or the state is getting from the federal government? I understand there's some kind of incentive that the federal government's provided for states to do this.
Well, there's not an incentive necessarily to the state. There's no money that comes from the federal government back to the state. The way a Medicare Advantage plan works is that the money that's paid into Medicare for your Medicare Part A, in the event that you pay for Medicare Part A, and your Medicare Part B is is a supplement sent from the federal government to the private carrier, for the private carrier to manage the plan. Simply put, Medicare Advantage plans came around because it became clear that private insurance carriers could handle health care for seniors at a lower rate than the federal government could do it. So that money is sent from the feds to the carrier, which is why you see the corresponding lower rates that we have for this plan as opposed to the plans that you see right now.
Bruce, well, back to you just for a minute. And I don't think we've got time to go into a long explanation, but I've seen some columns that you've written for your membership in your newsletter, and maybe you can talk about what the alternatives are for a retiree that doesn't want to enroll in this Medicare Advantage plan, and what the pros and cons are. And rather than going through it and outlining a detailed answer to that, tell the members of this audience where they can access these columns where you've identified, do your research, and you've gone through the alternatives, because there are some rather substantial negatives that Janice has outlined if you were to do that.
Okay. As far as the newsletters, probably the last two newsletters, the one for September and October, each have information regarding this business about how to make a choice and suggestions or what choices you are, as a retiree, are faced with. We have also put that on the website for the RSEA organization, which is RSEA4, the number 4U. .org. And again, as I mentioned, we've been trying to do as much as we can do to help our members understand what their choices are. Now, if a person chooses to stay with Medicare, and I think that's your question, if they choose not to go into the Medicare Advantage program, then what we believe is in your best interest. Well, let me back up just for a second. First of all, everybody should be doing research right now to figure out what costs will be incurred if you decide to stay with Medicare, and you get involved with looking at a Medicare supplement, and you will, if you wish to have vision, dental, and prescription coverage, you will have to purchase insurance separately for those as well. So those are sort of on the downside or the negative side. You need to be cautious about deciding not to go with the state's program, because they do offer those benefits along with your regular medical care. But if you decide to go and stay in Medicare, then you should be looking at, if you have a spouse with access to insurance, you should be looking at the possibility of going on to their insurance program, and that's certainly one of the possibilities. And then the others are what I just mentioned, is you look for insurance programs in the private sector that will cover those needs that you have. Now, one of the downsides I think that Rick's mentioning here is it's our understanding that prescription drug care, prescription insurance that's bought in the private market includes something called the donut hole. And I think Janice mentioned this earlier in her remarks, and that is your insurance coverage goes up to approximately $2,800, and then from that point up to maybe about $7,000, and those numbers are approximates, up to about $7,000, you pay everything. And then after there have been that much money, $7,000 has been paid, then you go back to being covered under the insurance program, and that's our belief on how that works. So it's important that people understand these things when they make that decision.
Thank you, Bruce. I brought this so that you could, all of you should be getting a booklet like this from Medicare in the last week or two. There is a discussion in this book about the donut hole, and your exposure, if you choose to do that, according to this booklet, is about $4,500 out of pocket. If you or your spouse is taking a lot of medications, you will be shocked at what the retail price of those drugs are. What I would recommend you do, I did this for my wife and I, is ask your local pharmacist to give you a printout of what you've had filled for this calendar year. It'll give you what your copays and deductibles have been, and then in one column there'll be the retail price of those drugs, and that's the number that will shock you. And I can tell you, it doesn't take very long to get to $2,800 or $2,900, and if you exceed that number, then you're looking at out-of-pocket expenses for approximately the next $4,000. So before you decide to buy a private Medicare supplement policy and a Medicare Part D prescription drug plan, be sure you look at those. When I did the research for my wife and I, for the two of us, it'll be about $450 a month premium to get those two plans. If you buy a Plan F, the benefits are standardized, and if you buy a Plan F Medicare supplement plan, there's no deductible and no copay, but you have this donut hole, and that's a significant issue. The other thing that happens is that, as Janice indicated, you waive your dental, you waive your vision, and so there are a number of things that you need to carefully look at. But I think it's time that we move to Will and let you explain the perspective of the retired teachers and what kind of reactions you're getting from your retired members.
Thank you. I'm going to follow Janice's lead. I like to stand and talk and walk around and use my hands and stuff. So just again, my name is Will Lovett. I'm a lobbyist for the Illinois Education Association. We represent members in the schools, K through 12, education support personnel, higher education members too. I'm also a member of the TRIP Advisory Task Force, and we discuss a lot of the issues that TRIP is dealing with, Teachers Retirement Insurance Program, and work through the benefit changes, benefit design, along with the premiums. So from the perspective of the retirees that I represent, and soon to be retirees, what we're dealing with is a constant attack on retirement security. Not just with health insurance as we're discussing today, but also pensions. And when members who have already made a decision to walk out of the classroom or in state employment, there really isn't an opportunity to go back. And so people make life decisions based on what they know. And every time that the legislature's in, we're dealing with constant attacks of your cost of living adjustment, things like that. So the uncertainty around those issues, the legislature being in, new pension proposals being put forward, really plays in the mind of my members, the members that I represent, because again, they have made a decision to retire and they cannot go back to the classroom. Coupled with that, the insurance issue, the two most important issues that our members in retirement, that they focus on. With the health insurance issue, we're dealing with, in a short amount of time, we're dealing with dependent audits, dependent eligibility verification audits to make sure that those dependents being claimed by those who participate in the Teachers Retirement Insurance Program, along with the state employees group insurance plan, the dependent eligibility verification audit adds to the mix of all this information being given to members who have retired. You also have benefit design changes, which consistently happen for those in the Teachers Retirement Insurance Program. The members that I represent, we do not collectively bargain the insurance program for teachers. We do not. AFSCME is fortunate enough to be able to negotiate the benefit levels for their members through a collective bargaining agreement for their health insurance. Our members also face premium increases on a consistent basis. The way TRIP is structured, the retirees pay a premium, the active teacher contributes towards the program, the state contributes towards the program, and so do the school districts. So our members do consistently have to pay more into the program, and when those costs continue to escalate, that hurts them, and it becomes an issue. Coupled with that, the national debate around health care. You have all this information going out around TRIP, around Medicare Advantage, and there's just a lot of confusion with what members are seeing, what they're hearing, a lot of information going different directions. And given that we just went through an RFP process, or the CMS did, and they've released the winning bidders October 1st, I believe. When members do not receive information about what to expect, but they know something's going to happen, Google fills the void, unfortunately. And when members go on Google, it's not information pertinent specifically to what's going on here with the state Medicare Advantage plan. When members hear of the private, what's going on in the state of Florida, maybe New Jersey, other areas, what the state is doing here is very different from what you see in terms of the opinions and views of what people say on Google or chat rooms and things like that. So with more information coming out every single day, I think what's been difficult for someone who represents, whether it's the 93-year-old who receives their TRS annuity and participates in TRIP and is not Medicare eligible, they need answers, and fortunately, answers are coming out on a consistent basis. The premiums have recently been released, and I think to tell members who have walked out the door and are living in retirement to take a deep breath and wait, and let's see what the information looks like. When you receive it from CMS, it's legitimate. It's not just some vendor or some insurance company coming out there trying to secure their business or to get them to sign up for something. I think as the information comes out, the premium levels, the benefit design, as Janice has gone through pretty thoroughly, I think members will breathe a sigh of relief to some extent. But it's with members being in the HMO, knowing TRIP as it exists today, dealing with competing benefit choice periods. We're going to have a benefit choice period for those in the state Medicare Advantage plan starting on November 12th to the 13th of December. But then you also have the benefit choice period that begins in May. That members have been used to having to contend with and make choices around their health insurance. Not only does that add to the confusion, you also have the age brackets that adds to the confusion. If you're 55 to 65, for those in Teachers Retirement Insurance Program, you are on TRIP. You do not have Medicare as your primary. You're not participating in Medicare yet. But when you hit age 65, you do start participating in Medicare, and that's when the state Medicare Advantage program you will be enrolled in that. But for those members between 55 and 65, they're hearing all this hubbub about a state Medicare Advantage plan. They don't know what it means, and so if they're not receiving information from CMS or the state, they think something's wrong, that they're missing something, and it's dealing with their health insurance. If they're not receiving anything from CMS, that means more than likely they're going to have to wait till May for a benefit choice period enrollment. But I mean, all of these things play in to what's been going on and the concerns around and the anxiety around which the members have about this program. I think that's really all I have on my notes. I didn't bring a speech, but I do have one thing. Before making the decision to not participate in the state Medicare Advantage plan, Janice hit this point, and I want to make it for my membership. Look at the booklets, look at the information, look at what the benefits are going to be for you, because I think members there will be a lot of new benefits added. There actually have been benefit enhancements. One of the benefit enhancements that Janice loves to talk about is silver sneakers, and I'm surprised you haven't spoken about that. But some of those things, there are a lot of added incentives for members to stay in the state Medicare Advantage plan, and for those in TRIP, as has been outlined previously, if you leave, you cannot return to the Teachers Retirement Insurance Program unless there's a legislative change. So please look at the booklet and make decisions based off of not before knowing what you're looking at. So, thank you.
Thank you, Will. I think it's important to emphasize a point that he made and one that Janice made, and that is that what the state is offering is a group Medicare Advantage plan. And so whatever information that you've gotten from other sources about Medicare Advantage plans, they are usually, almost in every situation, talking about individual Medicare Advantage plans that are marketed by a number of major insurance companies. These benefits are, as outlined by Dave and Janice, they are substantially different in many cases than what you would get under an individual plan. So if you are uncomfortable with going with the state plan and want to stay on Medicare, original Medicare, and you are going to shop for a Medicare supplement plan, be sure that you do not return or sign up for a plan that many of us are getting solicitations from insurance companies right now because it's the Medicare open enrollment period. Sign up for this Medicare coverage, and it'll be one of a number of very familiar insurance companies. Well, my warning to you is those are individual Medicare Advantage plans, and if you don't like the state plan, you're definitely not going to like the individual plan. So you be sure that you look for a what is called in the insurance industry a Medigap or a true Medicare supplement plan. And if you want to do a shorthand or a quick research on that, the Department of Insurance website is very good. You can go to insurance.il.gov, then click on health insurance and click on Medicare supplement. There are probably, their rates are out of date. They're probably a year old, but there'll be a comparison of maybe 19 or 20 different insurance companies, and the benefits are standardized. They're required by federal law that they all have to be the same. So what you're looking at is premiums and claim service, and so that is the major thing I wanted to emphasize before we go to Lee or Bob. Do you want to handle? I know we've promised that we're going to take questions from the audience, and Janice indicated that she'd be happy to stick around and answer questions that you have. So.
Okay. Something that Will mentioned made me ring a bell here, and maybe it was mentioned earlier, but it's been so long ago since this started. But people who are in the state employees, who are state employee retirees, will have the choice of moving back and forth, and that is one of the questions that I get regularly from people, that it's very confusing. They think that once they make the choice, they're locked into it, and that's not true, at least with the SCRS retiree system, that you will have the choice each year at this time of the year, between October and December, you will have the choice to get into the state's health insurance program or go back to Medicare, whichever your preference may be at that time. So I just wanted to sort of say that. If it hadn't been clearly mentioned before, I wanted to bring that out, because that seems to be give a certain level of comfort, knowing that if you get into a situation and you're not comfortable with it and you're not pleased with it, you do have an option of coming back to whichever one you were on before. Yes, well, yes, it does. A person that comes back to the state health insurance program receives all the benefits they normally would receive. Yes. I didn't say it wrong.
Yeah. I think I have some of my former employees from in the audience, and if I'm misspeaking, they can stand up and say I'm wrong. But my understanding is that if you switch, if you waive your state coverage, that if you do it and you want to sign up for a private Medicare supplement policy, you can do it once during the Medicare open enrollment period. But you cannot, as far as getting private coverage, you cannot jump back and forth. So if you take the state coverage and try it for a year and don't like it, and then want to go back on original Medicare with a Medicare supplement, my understanding is you'll be able to do it next year at this time. But if you do that, then you need to stay there, and you won't be able to jump back to the state plan if you want that private supplement coverage. So, do you want somebody, can you take a mic around and we're going to take some questions, and I would ask, rather than focusing on the procurement process and who got eliminated and why we don't have this and why we don't have that. I mean, I think our two retiree representatives here have done a good job of flushing that issue out. But if you've got questions that Janice or Dave haven't answered about what these plans entail and what we need to do, I think that now would be the time to entertain those. Who's got the? Up there. Who's got the mic? Up there. Okay. Go ahead.
Can you clarify Part D? You said we had to be A, B, and D.
Well,
D is the pharmacy.
D is the pharmacy. That's
so
correct.
Right now, the state is as good as D. So I understand we're not under D, but
Correct.
Are we under D?
Now, if you were to give up the state coverage, you would need to have A, B, and D. The pharmacy benefit that we have under the state plan is substantially better than you could get under a Part D policy. Is that correct, Jan?
Current coverage?
Yeah.
You currently don't have Part D because you have it as part of your medical benefit. Under the Medicare Advantage plan, you'll move to a Part D, but again, just like the Medicare Supplement, Medicare Advantage plans that are available on the street, it's a different Part D because it's one that we're controlling the design on. But yeah, so you will be in a Part D plan under the Medicare Advantage program.
But you said in order to get under it, I had to be A, B, and D, and I'm not D now.
No. When you
So
go,
I can't go?
no ma'am, when you go to a Medicare Advantage plan, in order to go to a Medicare Advantage plan, you have to be A and B. Okay? When you go to the plan, then you also have your prescription drug coverage, but that will now be covered under Part D as opposed to a separate prescription benefit like we have under the current plan.
Hi. My question is, if you decide to use the state and then want to go back to Medicare, do you not have to pay the Medicare premiums and a penalty for doing that?
You continue to pay the Medicare premiums regardless of whether you stay in traditional Medicare or you go to the Medicare Advantage plan. You still pay your Medicare premiums.
I understand that, but is there not a penalty for returning to the state? I mean, for returning to Medicare if you skip Medicare for a year?
There's not a penalty to go back to traditional Medicare, no ma'am.
This is a two-part question. One, those of us who live out of state, how are we going to be covered?
You have coverage available to you under the United Healthcare Group Advantage, Medicare Advantage PPO program. It's nationwide.
Okay. And secondly, those of us who will be traveling during your mailing period, will this be forwarded to the mailing address that we will be located in?
It will be forwarded through the Postal Service, or you can also access all of the information we're going to put forth on our website, including the seminar productions that will be available. Those will all be on our website. Currently, you access those through the Benefit Choice website. Moving forward on this, there'll be a link on the Benefit Choice page. We're finishing it up right now, but you will have a separate website that is cms.illinois.gov/thetrail, because if you didn't pay attention to that, it's Total Retiree Advantage Illinois, TRAIL. So that will be available as well.
There's another question for those of us who have medical issues and travel from state to state. How will we be covered?
Again, you'll still have coverage available under the group PPO plan from United Healthcare. That is a nationwide plan. So if you're traveling for medical treatment and you're seeing doctors currently who are Medicare providers, under the PPO plan, you should continue to be able to see those doctors because they're doctors that are certified already by Medicare.
Thank you.
I don't know what
Yeah,
else
I
we
can't
do
see.
down here.
That's just a quick one.
It depends on why she came into Medicare. If she came in because of age, not because of ESRD? Okay, so she came in due to age, not to the ESRD. Because she came into the age, then yes, the Medicare Advantage plan will apply to her. She'll get the documentation, or someone who acts on her behalf will get the documentation. And she'll be eligible for coverage because she seeks coverage outside of the state. She'll be eligible for coverage under the PPO plan. I don't know that I can answer every specific question with respect to her care. That is a question that really, when we do these formal seminars and the vendors are available to answer those kinds of questions, those are questions better put to the vendors, either at those seminars or on their phone numbers. All of the vendors are developing phone lines specific to the state of Illinois plan, so you're not calling through their normal customer service center. Where does she live? I don't know. So we have seminars scheduled right now in Springfield, Champaign, Tuscola, at Eastern, at Edwardsville, down at John A. Logan College in the southern part of the state, up in Rock Island, in Chicago, in Naperville, in Quincy. So we have a number of them, but again, the information is going to be on our website from those, and on Tuesday, we'll have the direct line numbers. All of the vendors have set up new phone line systems for this, so all of that direct line number information will be out as well. The 10% coinsurance, yes ma'am, that would be included in the out-of-pocket maximum. For her actual medical treatment, her out-of-pocket maximum should be $1,300 a year. Her shots or anything else that she gets, it depends on if those are deemed to be a medical treatment or if they're deemed to be a pharmaceutical. So that'll be a little bit different. The prescription costs don't apply to the out-of-pocket maximum. They don't apply under the current plans. They won't apply under this plan.
Janice, you mentioned a while ago, here I am, right here.
Okay.
Yeah, that if we want to stay where we're at, we can. Does that mean we have to have a supplement with?
You can't stay where you are.
You didn't say that.
I did
Okay.
not. I said it used to be. Usually when you get stuff from us, what we say is if you like where you are, don't do anything and you can stay there. That's not the case now. You have to make a decision now. You have to decide. And if you can still see me and I can stand here, that's even better because then the lights aren't on me. If you want to opt out of the plan, we want you to technically opt out. We want you to physically make that choice. If you want to stay with state coverage, you have to choose one of the Medicare Advantage plans.
Okay. Thank you.
Okay, Janice.
We know we paid 1% of our annuity August 1. Next year, will we pay another 1%?
That's the current design. 1%, an additional 1%.
Okay, I have a question. Do we, you probably already said this before, but do we have to continue to pay for Part B?
Yes, you continue to make your Part B premium payment just like you do now. So to the question earlier about, well, what if I get out the penalty question, you are never leaving traditional Medicare. You're still paying traditional Medicare every month, either directly through a check or through your Social Security payment.
Rick, last question. Go ahead, wrap it up.
Oh, really? Okay.
Okay, I'll wrap it up then. Thank you for joining us this morning. We really appreciate it. The Citizens Club of Springfield has enjoyed presenting that this morning. Thank you very much.
Please.